Hello, my name is Leah Silvert and I'm a graduate level researcher in maternal mental health. Today, I'm going to be presenting on Matrescence, a biopsychosocial model for holistic maternal mental health care. Our team includes Dr. Orly Athan and Naya Gurbin Singh, and we are based at Teachers College, Columbia University in the Department of Counseling and Clinical Psychology. We conduct research in maternal psychology and reproductive health. Our team consists of a reproductive psychologist and graduate students who think about the stages and phases of maternity. We work from a feminist-informed intersectional framework and center subjectivity in order to provide the best quality of care for women and families in the transition to new parenthood. Our current maternal mental health model focuses on PMADs, that is, perinatal mood and anxiety disorders. It focuses on risk and psychopathology and uses a clinical and biomedical lens. While we are seeing unprecedented growth in public awareness and screening for mental health issues around pregnancy and postpartum, we are suggesting that the PMADS model limits our understanding of maternal mental health and women's health. We call for a critical refinement of diagnostic criteria. Given the shortcomings of the PMAD paradigm, we would like to introduce a new term, matrescence, like adolescence, which comes from anthropology and the study of the transition to motherhood. We are adapting and applying this term to the field of mental health in order to create a new holistic adult developmental framework that captures the spectrum of well-being and domains of change in the transition to motherhood. It includes risk and resilience, clinical distress, normative distress, and flourishing or thriving in several domains which I will define in the next slide. There are many changes taking place in the transition to motherhood and can be categorized into 5 equal domains, as shown in the pie chart on the left. In the ecological model on the right, we see the mother's psyche at the center. Concentric circles spanning outward and downward and upward spirals indicate various systems impacting each other reciprocally and concurrently. For example, the changes taking place in the biological domain affect her psyche, but her relationship with the biological changes also affects her well-being. In each domain, we assess for pain points and growth points. This model helps to not only assess for a mother's reproductive life acts, but captures her subjective meaning and understanding of herself within the various domains of change. We recommend assessing for changes at multiple time points during the prenatal and postnatal period. The process of becoming a mother spans multiple domains. For example, the biological level includes changes in the body and hormonal fluctuations. The psychological includes changes in identity, personality, self-esteem, and self-concept. The social includes the reevaluation of friends and familial kinships, and changes in social status and leisure activities. The economic political includes losses or gains in professional status and benefits from social policies such as daycare and paid parental leave. And the spiritual includes existential questioning, self-transcendence, meaning-making, and an affirmation or newfound appreciation of religious or spiritual practices. All of these changes taking place occur differently for each individual woman and may even look different within a woman's life with each new child. The exact length of matrescence is individual and may last a lifetime. So implications for practice. This model of care yields several implications for research, practice, and epistemology. Firstly, we are moving out of a biomedical model and expanding to a biopsychosocial model, where women have more normative, developmental, empowering, and strengths-based lens so they can view themselves more holistically. Our matrescence assessment model allows practitioners to assess for a range of changes in multiple domains that may indicate normative transition to clinical distress to flourishing. A broader assessment that focuses on resilience as much as risk may help facilitate trust, self-disclosure, and rapport building between provider and client as it takes into account contributing contextual factors outside of the individual. Lastly, mothers are given a much-needed opportunity to reflect on the range of changes taking place and in turn express any self-determined needs. Unlike shorter screening tools targeting the presence of PMADs, if conducted optimally in a person-centered, collaborative, and non-judgmental fashion, it should increase feelings of agency and self-efficacy in the developmental process of becoming a mother. With Matrescence, we offer a paradigm shift for perinatal mental health clinicians and researchers. Thank you. Please feel free to reach out with questions or collaborations. The Maternal and Reproductive Psychology Laboratory based at Teachers College, Columbia University aims to train the next wave of clinicians, researchers, and theorists of maternal well-being and reproductive health.